Fill your thirst beside the river. Wash the journey from your hands. Feel the comfort flow inside you. Come this far, you understand. Fear's not allowed, where dreams can be lost or found.
Hello and welcome to Healing Outside the Box. This is our 24th show, and the title of the show today is Are We Addicted to Drugs? I am Traci Crampton, and I'm an energy practitioner.
And I am Rosemary Lachance, and I'm a Reiki healing practitioner.
Today we have
With us, Dr. Today we have Dr. James Sensenig. Welcome. So nice to have you again.
Rosemary.
Oh, wonderful.
Traci.
And I'm going to read a little bit about Dr. Sensenig before we start the show. Dr. Sensenig has been practicing naturopathic medicine for nearly 30 years and is well known for helping thousands of people regain their health. Dr. Sensenig sees patients with complaints of all kinds and is particularly interested in the treatment of digestive diseases, headaches, and migraine, joint and muscle complaints, and chronic fatigue. He also sees children with health problems ranging from asthma and eczema to developmental displays and autism. Dr. Sensenig graduated from the National College of Naturopathic Medicine in Portland, Oregon, where he later served as Dean of Education. He was the founding president of the American Association of Naturopathic Physicians, the chairman of its Government Affairs Committee for a decade, and the founding dean of the College of Naturopathic Medicine at the University of Bridgeport, Connecticut. Dr. Sensenig has consulted for a number of government agencies, insurance companies, colleges, and natural products companies. He is on the faculty of the Southwest College of Naturopathic Medicine in Tempe, Arizona, and the University of Bridgeport College of Naturopathic Medicine. Okay, that's very good. So the title tonight is Are We Addicted to Drugs? And my first question to you is, why do so many people use drugs?
Well, that's a good question, isn't it?
drugs of all kinds.
I think that as we were talking about privately at one time, the use of drugs, and we'll talk about why they can be used and so on, obviously, but it's gotten out of hand. In the United States, we consume more drugs than any other country in the world, by far. Some interesting statistics, actually. Just recently, we passed a milestone in this country where it is now sort of official that over half, 51% of Americans, use at least one prescription drug every day.
Wow.
And the per capita consumption of drugs is about 10 prescriptions per person per year. Now that may not sound like a lot, but you think about what it might have been just 40, 50 years ago. Because your average person is using 10 different prescription drugs a year. And of course many people are not. So some people are using a lot more than that. So here we have half the population using at least one drug a day. And we have the average person actually using 10 different prescription drugs a year. We have, well, the numbers go on and on and on. You know, about, depending on who you talk to and what the statistics look like, somewhere between 25 and, according to some researchers, 33% of school-age kids are on some kind of psychotropic medication so they can sit still in school.
That's
a third of our kids. You know, one of the things we have said, you know, privately and in our practices and so on. Can you imagine if any other country was drugging its kids to sit still? I mean, what would we think of them? What would we make of that?
right, exactly.
So is it 33%? Is it 20%? I mean, who cares? That's a lot of kids.
I often ask myself that I was having this conversation, like, you know, would I hire a babysitter who spoke that way? Like, if I have a temper tantrum with my kids, you know, like, would I, you know, if you look at it from an outsider, it seems bizarre that we're doing this.
Well, it's even more bizarre than you think. There's something like, and I'm not exactly sure about the number, but it's pretty close, something like 1.5%. You ready for this? 1.5% of 2 to 4-year-olds are on psychotropic medication.
2 to 4-year-olds?
2 to 4-year-olds are on psychotropic medication. We spend more money on medication than any other country in the world. there are over 100,000 people who die from the side effects of their drugs every year.
Oh.
And somebody in the listening audience is thinking, well, we have this great health care, we must be number one in the world because we're using all this medication, and of course we have the best health. But that's not the case. The U.S. healthcare system ranks 37th in the world according to the World Health Organization, and the U.S. population ranks 92nd in healthfulness out of 191 countries ranked by the World Health Organization.
Boy.
So we may be number one in the consumption of drugs, in the per capita use of drugs, in the side effects from drugs, and we rank 92nd for that. That's a huge price to pay for the 92nd best healthcare in the world.
It is. It is. Okay, a question people are going to say, don't we need drugs?
Of course we need drugs, and we need we need drugs for a number of different things, and mostly we need them for life-threatening situations. We need them for infections, and so on and so forth. But we're at a point now where we're being marketed a drug for everything. You sneeze the wrong way, you need a drug for this. You don't feel good, you need a drug for that.
Are we only one of two countries that actually has commercial?
Oh yeah, the commercials.
Yeah,
oh
for
my
drugs.
God, the commercials.
Yeah, I'm not sure.
I
I'm not
heard
sure
that it was
about
just
that.
U.S. and
U.S.
Sweden.
and Sweden, I think, yeah.
But,
I don't
and
know about that.
That might be different, but
And there are so many.
you know, to really think of how it's marketed to us.
Well, when you look at TV and
Every day
print
it's
media,
suggestive.
every other page, every other commercial is about, you know, it's almost like what you're being sold is not the drug, but that you need to look good, you need to feel
right,
good.
the
you know?
image
Right.
that they're portraying.
And you know what's really amazing to me is in the ads you've got the beautiful people running through the field, playing with the dog, throwing the kid up in the air, whatever it is, and these beautiful people are taking drugs that can cause drowsiness, you know, balding, impotence, you know, their skin can fall off, and by the way, they can cause death and whatever
Maybe
else.
the
when
whole
they do
image is just
Right.
their hallucination.
Right.
You know, I have to say this. I just saw this on TV last night. I couldn't believe my ears. You know, the what is it for men? Help men. What is it called? I can't remember these names of these drugs. What is
for
it?
the erectile dysfunction.
Yeah.
You know about erectile dysfunction?
Yeah. What's the name of the drug?
Well, there's a number of them.
Well, just give me one. Give me one.
Viagra is
Okay,
one of
say
them.
Viagra. Okay, we have 36-hour Viagra, but now we have everyday Viagra, so you can always be ready. I just think that's so funny. But if it lasts more than 4 hours, call it. Can you imagine the men around town walking around? That's too funny. That is just silly thing. Now we have every day.
Every day.
Every day. Oh God.
Well, you know,
Sorry, it's just too funny.
If you're right, but if you get away from the humor in that and actually the medical problem that that would cause,
Yeah.
But think about that for a second. What if the drug ads had not the smiling, beautiful people enjoying themselves, but instead it showed the folks who are suffering from the side effects?
Oh yeah. Wouldn't that
What if
be
we
good?
did
That'd
that?
be
What
great.
if we did? What if we just required not just a disclaimer, the verbal disclaimer that said this can cause this and this and this and this? Why don't we show the patient or the person who's suffering from the side effect, whose hair is falling out, whose skin is falling off, whose whatever the side
It's
effects are?
falling off. It's terrible. I know.
And that's part of that whole addiction problem. I mean, we're just being fed that image every day, everywhere, and you
Well, it's
know,
not-
we need to
right.
have it. People think they need. Oh, we definitely need this. I gotta run out and get it.
Well, and I think, you know, it's not enough that we don't look, you know, you don't look right, you don't look like everybody else, and you're not as happy as everybody else, and so on and so forth. But there's this sort of, we're being sold this ideal that doesn't exist.
Yeah.
And at the same time, we're being, I guess the word is we're trying, the drug companies, and for that matter the medical profession, seems to have this attitude that anything that's the slightest bit off kilter needs to be medicated. I had lunch just this week with a cardiologist right here in this area. I won't say what town it was in. And one of the things that he said casually at lunchtime, this is a cardiologist now, and I guess all your listeners know cardiologists is treating heart problems, and the thing that cardiologists see a lot of today, of course, is coronary artery disease and high cholesterol and high lipids and so on and so forth. And one of the things he said, just sort of in passing at lunch, was most of what I'm treating are lifestyle diseases.
Right.
In other words, I'm treating symptoms that are occurring in people because of the choices they're making in their life.
Right.
Now, Why doesn't the medical profession or our culture say, if you're making these choices, change your choices?
Change your choices.
Right.
Instead, we're encouraging or allowing or...
Oh, you don't have to change your choices.
we don't have to
You could just
change
take a
anything.
pill
We got a
yeah.
pill. We got a pill.
I don't think the drug companies want us to change their choices because then we won't be taking their pills. You know?
And the body, the body's designed to be a compass for us to, to actually stay with your body long enough to feel, some discomfort and some imbalance. You can learn so much, but we're so quick to just shut that up right away, shut those messages up. And
well, that's a
not
very interesting point you're making, Tracy. When people do this with drugs that are illegal, when
Right,
they
same
turn off
thing,
when
right.
they turn off the
It's an
pain,
escape.
they turn off the signals, they turn off the hurt, and that's done with drugs that are acquired illegally. That's a crime. But when they're done with prescription drugs, that's done in the name of health somehow. And I agree with you. The philosophy in naturopathic medicine is just that the problems that we call disease, whether it's high cholesterol or back pain, are your body's way of telling you that something's out of balance.
Yep.
So if that's true,
Right.
if the symptoms and the signs of disease are the signal that the body's out of balance, then the only logical way to treat those things, the signs and the symptoms, is to restore the balance in the system, not to cover them up or suppress them or or numb them, as in,
Right,
in what you're saying.
So why are there so many side effects from drugs?
Well, actually, that gets to be an interesting philosophical question when you look at it from a naturopathic doctor's point of view, which is this. Every drug, by definition, every drug has side effects. Why? Because drugs are designed to treat symptoms. Actually, in the language of naturopathic medicine, drugs are designed to suppress symptoms, exactly what Tracy was just talking about. The symptom is telling us that something's out of balance. We're stopping the expression of that imbalance. We're stopping the inflammation, we're stopping the high cholesterol, we're stopping the pain, we're stopping the whatever. When you do that, you not only don't correct the underlying problem, but you do what we call suppressing the symptom. So that imbalance, which is the disease, the real disease, has to show up somewhere else.
Right.
So every time you treat only a symptom, you have to create a new problem. As a matter of fact, I don't know if you've talked...
who made that said it was like the whack-a-mole. You hit the ball and it
whack-a-mole.
pops up
When
somewhere.
that's
Pops up
exactly...
another hole.
There you go. Right, exactly.
That's exactly the image we use when we're teaching
Right.
this. You whack down the symptom of one sort, it's got to pop up somewhere else, and you got to whack it down again. And in conventional medicine or allopathic medicine, you have a different specialist for each mole.
Yes.
Right.
You have a gynecologist
And they're all
and
hitting at the same
that's right.
time, and it's all going crazy.
Right.
I know.
And by the way, I don't know if you've talked about this on
Yeah.
other shows, but I just use the word allopathic, and I know that medical doctors sometimes use the word allopathic, and I don't remember if either of you just used the term allopathic as well.
Yeah.
The word allopathic is from the Greek, which means other disease. Allo means the other, and pathic means disease. And it's now we're talking philosophical descriptions here. We're talking about what it is that a doctor does when he treats you. If I can be so, what shall I say, detailed, as to back up here a little bit. When you go to a doctor with a complaint, what the doctor is offering you depends on what he or she thinks they're doing. And that depends on what he or she thinks disease is. This has been widely studied. There have been books written about it.
Right.
Perhaps one of the most prolific writers is a person whose first name I can't remember, last name is Pellegrino, who's right here in this area at Yale, who writes about the philosophy of medicine. Your intervention, which is what we call the therapeutic rationale, is based on what you think is going on here, right? If you think the symptoms are the disease,
Right.
then you treat the symptom. When you do that, you create a new problem.
Right.
You create another disease, allopathic. So allopathic medicine is a way of practicing the official definition, if you will, that is to say, the dictionary definition of allopathic medicine is the treatment of disease by replacing one condition with another one.
Oh.
Okay? Now, it's not spoken of, and that goes right to the question about drugs. It's not spoken of in those words in our culture, but that's what it means. You replace one problem with a new problem, one disease with a new problem, allopathic medicine. And that's why when you treat symptoms, you're always creating this new problem. Now, persons who practice in that way, and they can be medical doctors, and I have to say this, they can be naturopathic doctors, they can be allopathic doctors. It's not it's the way the person is practicing.
It's the mindset.
When one is treating symptoms and creating this new problem, they're not spoken of as new diseases. See, the doctor's not going to tell you, I'm going to give you a new disease in place of the one that you have.
Yeah, I guess not.
But they are doing it. The new disease is called a side effect. Right? The name for those things is side effect. You asked about side effects.
Right, exactly.
If you think about dis-ease as an imbalance in the system, then we have replaced one with another. We're not going to call it a new disease, but we're going to call it a side effect. And then, back to side effects.
Yeah, that's a way of minimalizing the impact of the...
Well, because I think the philosophical idea of disease isn't understood. See, again, for a naturopathic doctor, disease is a disturbance in the system which manifests in a certain way, different way for everybody, every person.
Imagine if they say in the new diseases this would cause are, like, it would really catch people's attention. Like, we just say, oh, side effects, they're minor.
Right, exactly.
Well, that's really
good. That would be good if they put it that way.
Right, exactly. But see, disease is defined differently in conventional medicine, so that's not what's happening. There's side effects. Which, back to side effects for again. Now, if you go by that, if you work in that model, then your intervention with these chemicals that suppress the symptoms is always a risk-benefit ratio. The question the doctor is asking, the question the pharmacist is asking, or the question the patient is asking is, do the benefits outweigh the risks?
Exactly.
What are the risks? The side effects, the new disease. You know, we're teaching, we joke about the fact, you know, I'm sorry, Mr. Smith, that your hair is falling out and that you're impotent, but at least your blood pressure is normal, you know? Or when a doctor says to you, I'm going to give you a medication to lower your cholesterol, there is a possibility of liver damage. It's relatively minor and it doesn't happen that often, but I need to tell you that it might affect your liver. What he's doing really, and I'm not trying to be funny here, what he's saying to you is it's more important for you to lower your cholesterol than it is to worry about your liver.
Point right now.
Pardon?
It's like they're treating that because this is what's in crisis right now. So it's like, let's deal with what appears to be in crisis, and then, you know, another problem develops, which will ultimately probably become a crisis as well. And then what?
Right. And my point, of course, is that you're asked to trade one thing for another. And the implication, even though it's not laid out that way for you, the implication is that what you're trading off, it's better to control what you've traded off and accept the other thing. And then that brings up another good point, Traci, because if you trade one thing for another, then what's happening in conventional medicine, as I'm sure both of you know, now you take something for the new problem, and then that causes a new problem. And we all know, everybody knows, everybody in your listening audience knows of someone, an elderly person, you know, who's taking 10, 20 different...
I know, and they have to get the list from the pharmacy of like all, like, will these interact and what are the interactions?
And each has been prescribed for the side effects of something else. It's like a domino effect.
Yes.
Right?
You're right. You're exactly right. These poor people who just don't understand that. It's terrible. It's really a shame. It really, really is.
And so I think something that I think about too is that, like I said, you know, like you said, sometimes medicines are necessary. Like if you're at a critical point and, you know, you really need, just like if your leg is broken and you need to have it mended.
Oh, yeah.
I mean, you know, there's a need. But the fact that we get on these drugs and we take them for such extended periods of time and we forget, you know, to even check in with ourselves, is the body back in balance? Do we still need this? Are we just taking it for the sake of taking it because, you know, once it's prescribed, you know, how do we get off of it? And, you know, there might be side effects coming off of it, and how do we establish normal again?
Right.
That's something a doctor should tell you.
Yeah.
You know, that's what he should tell you.
Well, you know, as you're saying...
Are we taking them too long, you know?
Right. As you're saying that, I'm thinking two thoughts about that. One is that I'm not here to
Right.
medication,
Right.
because there's a time and a place.
Right.
Exactly.
There's a time and a
Yeah,
place
there
for
is.
everything.
And I'll say straight out, if it wasn't for conventional medicine, I wouldn't be sitting here talking to you. You know, I've had a couple of who hasn't had in my own case, a traumatic motor vehicle accident or some other life-threatening problem
Right.
where conventional medicine
definitely.
has come to the rescue and the medications are needed. Or, for that matter, even a minor infection or something
Right.
like that. But it's the overuse and the abuse.
Yeah, that's what we're
And then-
talking about.
And then the other side of this, which is not obvious in our conversation, at least not to the listener probably, is I'm coming at this from the point of view of a naturopathic doctor, meaning that it's not about medication, that is to say, drugs or no drugs. It's about what can you do, as Traci just said, what can you do instead?
Right.
You know, must we take statin drugs to lower our cholesterol, or can we exercise? Can we change our diet, right? And can we use natural substances, things that are normally found in the body, are part of the body, have no side effects, to treat or control these problems, because you're restoring balance in the system, not just treating a symptom again.
Right. Like if your blood pressure is so high that, you know, you may have a stroke or a heart attack in that moment. You need that medication. But as soon as you lower it, shouldn't we say, okay, you know, let's pull back on that and replace it with this course of action? But I feel that there's a lot of pressure for the physicians, and they're saying, okay, they write the prescription, you have to take it this long. You don't even think about getting off of it, you know, for
Well, that's true.
X number of
Right.
years. I mean, and
But
if you and you know, they really encourage patients not to. Well, I'm not saying every doctor, but many doctors encourage, because I feel that they're taking a risk by saying, once you needed this drug,
Well, if you
to
believe
say that now you
Yes.
don't.
If you believe that the problem, you're talking about high blood pressure.
I'm just using
If
that
you
as an
believe that the
example.
problem is not curable, then you will be, as a doctor,
Right.
then you will be
have
you will
that
be
mentality.
encouraging your patient to stay on that medication for the rest of their life. But think about this talk about philosophical issues as well.
Mm-hmm.
Think about this for a second. If you have to take something every day of your life to control a symptom, you're not curing the problem,
No,
right?
you just
If you were curing it, there would be a point where you would wean off the medication. Assuming the medication is necessary for health and well-being, if you are back to normal, there will come a point when you can wean off of that medication with the help of your doctor or pharmacist or whatever.
But I feel that so many people are afraid to broach that with their doctors. They're afraid to even say, like, you know, hey, you know, maybe it's time for me to cut back on this, or eliminate it altogether. There's not a lot of support.
I cannot
that.
tell you how many people we see in practice who are afraid to have an open discussion with their doctor about many things because the doctor may get angry or may get mad about it. And I had somebody recently where we were talking about some changes that I was recommending, and the person's reaction was, well, if I talk to my doctor about that, my medical doctor about that, I don't think he's going to be very happy. And my response was, it's not your job to make your doctor happy. As a matter of fact, it's your doctor's job to make you happy. Right? You don't have to be in the position of taking care of your doctor's ego.
Yeah.
And if you are, you need a new doctor.
I've heard that too. Oh, no, he's going to get mad at me. No, I don't want him to get mad at me. I've heard that, yeah. I've heard that.
Well, now, let's talk about that for a second. If you're going to a doctor that you can't talk to because he or she is going to get mad at you, what kind of a relationship is that?
Right.
That's
I
not
know.
a healing relationship. That's
No.
not an open relationship. And that's not the kind of relationship you want to be in. Whether it's with your doctor or a spouse or a child or anyone else. If you can't have open communication with the person who's supposed to be helping you stay healthy, what are you doing?
I know. You're absolutely right. You're absolutely right. I wanted to interject something here really quickly.
I saw you reaching for that book there.
This book here, The Future of Food, and I know it's written many other places too. It's about, they talk about cholesterol, and it says here, cholesterol causes heart attacks, so it must be removed from our diets. It says few compounds have had such bad press as cholesterol, yet this is a vital substance in our bodies. Cholesterol is an essential constituent of the insulation that coats our nerves. It is as vital as the plastic insulation in a telephone exchange. The breakdown of the insulation layer short circuits nerve impulses and produces devastating consequences. In multiple sclerosis, it is the cholesterol-rich insulating layer that disintegrates and causes the symptoms. Okay?
This is so fascinating because, for especially young children who, like, every parent who's, like, obsessed with low-fat diets and watching their cholesterol, and they're taking all the fat out of every product, and then they're giving their kids, skim milk and this and that, and the kids just aren't getting enough fat, and they're wondering why, their brains can't develop properly because they don't have the coating on the nerve cells.
Exactly.
Well, it's not just that. The central nervous system, the brain, is about 80% fat by weight.
Yeah.
And some people feel that there's a correlation between developing senility, what's now called Alzheimer's disease, and our fat phobia in the United States.
Exactly.
How can your brain continue to function if it doesn't have the building blocks it needs to function?
Right. Not that cholesterol doesn't get to be a problem with some people, but I think that it's the types of fats we eat.
And if you watch your cholesterol, the body's going to make it anyway. That's what happens. The body makes it. Cholesterol is produced in your body at the average daily rate of 10 milligrams per kilogram of body weight. If you eat a diet rich in cholesterol, the amount produced in the body goes down. If you eat too little, the body produces more. So
your body's always trying to regulate the cholesterol.
Exactly. It doesn't need it. And it says, the last thing I want to say, because this is long, but they should get this book to read this. It says, you might think that a cholesterol-lowering component of food would be important in the future, since the only effective way to lower cholesterol is with drugs, known collectively as statins. Surely future food would need to include products that contain these substances. And Dr. Urfi Ravenscoff, a Swedish specialist, has surveyed the literature and concludes that neither heart mortality or total mortality have been improved with drugs whose effect is only to lower the cholesterol level. On the contrary, he emphasizes, these drugs are dangerous to your health and may even shorten your life. So this is the book.
It's interesting that you are picking this issue, because what you may not know, and what your listeners may not know, or your viewers may not know, is that within the last few weeks, the American Academy of Pediatrics has come out officially recommending that children as young as 2 years old be tested for cholesterol and be put on statin drugs now in order to prevent future problems.
Horrible.
Instead of teaching children to eat properly and to get outside, we're going to put them on statin drugs. This is the American Academy of Pediatrics. This is America's pediatricians who are recommending this to you moms and dads in America.
It's like the world's gone mad. It just seems
like you want to just say, stop the madness. Stop the madness.
People haven't been drug-free for so long that they don't even know what normal is. And I'm not even talking about people who, like, I haven't taken a prescription, maybe 2 in the last 5 years, but you get it even if you're not taking it. You get it in your water supply, you get it in your food, the medications that are given to the animals are passed on to you. I mean, we are so overloaded, even if you make a conscious choice not to take medication over the counter or prescription medication or illegal, that you're still being bombarded with drugs.
It's a problem. A problem that you don't hear much about. You're not only getting traces of various medications in the food supply, like antibiotics, for example, but also hormones. If you look at, and this is easy to find, look at it on the web. I mean, this information is everywhere. In every municipal water supply in America, there are traces of prescription drugs.
I've just read that.
Because this stuff is being flushed down the toilet,
from the hospitals,
or it's actually being excreted in your own body. I mean, where's that going? You're flushing it into the sewage system, and when the water is cleaned or purified for reconsumption, those medications or residues of those medications are not removed.
And sometimes, in some cases, they get stronger through,
by concentration.
By concentration.
So people are drinking water with all kinds of medications in them, albeit at very small levels, but it can only be increasing. And you know, one of the things on that same line, one of the things that just amazes me is we've reached the point where everything's green now. Green this, green that, green that, right? People don't want chemicals in their cleaning products or in their rugs or in their baby food or their pet food or their beauty products, right? They don't want to use plastic bottles to feed their babies because of the possible side effects of the contaminants and so on. And then they go to the doctor and they put these chemicals in their body. You know, all the cry about cleaning up the environment. What about the personal environment? What about the internal environment? There's more pollution going on the personal level than there is in the rest of the planet combined.
That's right. Yeah. It's exactly, you're right. It doesn't make any sense. It's like, to me, like the pill, they have a couple of pills to help you stay calm. People who
well, unless you're too calm, then you need a pill to get you jacked up.
Yeah, right. You know, what are those? I can't think of them because I don't take them.
Anti-anxiety medications.
Right. Yeah. And then, so somebody said to me, like, at a time in my life when things were, something happened, in my family that was drastic. Why don't you take this, and take that and, get you through it? Well, I've heard that once you get on this, it's hard to get off of it. And also it says, well, why don't you take this till you feel better? Wait a minute. It's going to make me feel better. But how do I know that I'm better when it's the drug that's making me feel better? So I'd rather go through the suffering, and then when I'm better, I could say, oh, I'm better.
Right.
You know what I mean? That doesn't make sense to me, I don't know. Just doesn't make sense to me.
Yep.
Do all drugs have side effects?
By definition, yes.
Yes.
Because of the way they're used. Right.
And aren't they regulated by the FDA?
Well, they're supposed...
Let's open another door.
Yeah, they're supposed to be, but there's been a lot in the press about the FDA in recent years, about the lack of funding and resources, that they don't have what they need in terms of manpower and computer software to even process the complaints that they're getting. And there are people like myself who feel strongly that the FDA has a bias.
Yeah.
And one of the examples for me is, well, one of the most notorious examples in recent memory here is that the drug Vioxx was being watched by the FDA's Adverse Effects Office for years, and it was responsible for, the use of the drug was responsible for 141,000 deaths.
My God.
141,000 deaths before the FDA did anything. And then they didn't really do anything. What happened was the person who was in charge of the Adverse Effects Office, or maybe not in charge, but the person who worked there, Dr. David Graham, finally went to the New York Times. And the story at the time was that the internal channels were deaf to his information. So at 141,000 deaths, he goes to the New York Times, and the New York Times broke the story. Dr. Graham got fired.
God bless him, though.
Dr. Graham got fired, and it's business as usual there. So who's the FDA looking out for?
I know.
And here's my personal solution to this problem, by the way. I don't know if you know this, but within the year or so, the head of the FDA, or its equivalent in China, was executed after 8 people died from the use of a drug that was approved through bribery. He was accused, someone in the agency was accused of bribery, and it resulted in 8 deaths. And the Chinese government took him out and shot him.
You don't deserve this job.
Well, look at the difference in the threshold.
Exactly.
8 people, the man was executed. 141,000 in the United States, and the FDA looks the other way.
Yeah.
Now, why don't we set a standard like that? You know, if you are a regulator and you're responsible for, I don't know, 100,000 deaths, then you deserve the death penalty, perhaps.
Yeah, at least prison. Yeah, at the least.
Yeah, 100,000. Maybe we should make it 50,000. Maybe 8's too low. Actually, maybe 1 is just right. I don't know, but 141,000 people, and that's only one drug. Only one. And the FDA is looking the other way. So is the FDA protecting people against the side effects? I was shown an article within the last week or two, which was an AP article, about all the medications that the FDA is now looking at that are already approved. They're already approved and they're already out there, and they're basically saying, whoops, these things have serious side effects, right?
But they were able to run their stint and make the money for the companies that produce them.
There's another phenomenon that the public doesn't know much about because it's been designed that way, and that is when there are wrongful death suits for various medicines. Many of these are settled out of court.
Oh yeah, so never.
For very nice sums, and the plaintiff is forbidden to discuss what happened. Any details of the case are forbidden to be discussed publicly. So in any other endeavor, that would be called hush money, right? So there are cases where the public has prevailed against a drug company for wrongful death that nobody knows about, or very few people know about, because part of the settlement is we're not going to talk about this.
That's
and
right.
I'm not making this up.
No, I believe you.
You can find this if you look in the right places for
They've
this.
made a couple of movies like that too. I think movies are great. At their best, movies are wonderful. They tell the stories, so people don't believe that. There was a couple of them like that, remember? A couple of really good movies with like that. That same, just what you're talking about.
Yeah, and willing to take it all the way and be public about it.
And the same thing what you were just saying about the FDA is going to look into these drugs. I read that on the internet, right? And you
don't hear any follow-up.
Exactly.
It's like, okay, we'll look into it.
Yeah, exactly. Then you don't hear anymore. Hello, I want to know what happened there with that story.
To that.
But you know, on the other side of this, as a doctor of naturopathic medicine, one of the things that just, as I said, I heard somebody say recently, grinds my gears, is if there's an herb or a vitamin or a mineral or a plant substance of some sort where somebody dies, it's dangerous.
Oh, God.
It's dangerous. It's off the market. You know, oh my God, vitamins are dangerous. Oh my God, herbs are dangerous.
Exactly.
Right? But 141,000 people can die from medication. Well, business as usual.
You're right. You're exactly
And I think
right.
people need to start asking, you know, are these committees really looking out for us? You know, are they really looking out for the welfare of the average Joe Schmo who is trying to find some
And most of the time, the
solution.
reason that happened is because the people took too much. They didn't seek a naturopath to find out how we should do it or anything else.
Right, which
they took it into their own
I've often
hands.
said on this show too, like, you know, just because they seem more of the earth and more natural and more readily available, you still need to get some guidance about supplements.
Yes,
There are
definitely.
herbs out there that are very strong and have very
We're a nation of, if a little bit helps, geez, just think what a whole lot will do.
right, and not just that.
Could kill
People,
you a
you know,
whole
hear
lot.
from their friend, oh, you know, St. John's works for me, but it might not be what their body
Exactly.
needs for that.
That's right.
You know, they might be displaying the same symptom.
Right.
And I mean, I think this goes also with conventional medicine too. It's like with the advertisement, oh yeah, you know, this worked for so-and-so, she's not depressed anymore, maybe that'll work for me. I mean, your body is different. You could be requiring some completely different type of medication. And you go to your doctor and you're like, I need this, and
Exactly.
woo-hoo, here you go.
She's not depressed, but like I said before, it's because she's taking the who is she? I don't know, but she's not depressed. She doesn't know who she is, but she's not depressed. That's all we know, you know. I don't
She's
understand
dancing in
that.
a field of lilies.
Yeah, I don't understand that kind of thinking. I always say there's a big disease going around this world, and it's called LACKA, lack of common sense.
Yeah,
Right?
right.
If people would just stop and think about these things, but they don't.
And I just, even energetically, because we, Rosemary and I are energy healers, so these also are exuding from us into our energy fields, and you're in other people's energy fields all day, so even if you're not taking the drug, you're being affected by the side effects that they're being affected by. I feel it when I'm doing energy work on people and they're taking something. I feel like, things are stunted, or there's parts of their energy field that just feel like really voided, or... And if you're not aware of that as just an average person, not up to date on the energy work, then you wouldn't.
I'm glad you brought that up. I had a client recently who I did, Reiki on, and up around the head, the top of the head especially, I felt a lot of energy. As I started to go down the body, the more lower and lower I got, it got cold. There was just nothing. There was nothing. I told her a couple of things that I got intuitively for her, but that's all. And she said to me, gee, I wonder why. I went to another Reiki practitioner about a year ago or so, and they told me a lot of things. And I go, well, I said, it was nothing. There was just nothing. It was just like, She said, oh, I know. She said, a year ago, I started taking, I can't, those drugs again, what are they? They make you...
An antidepressant?
Antidepressant. I can't think of the name of it. Zoloft. That's one, isn't it?
There's
Okay.
quite a few.
I
yeah.
started taking that. That's why she goes, and I feel I'm not depressed, but I'm not anything. I don't feel kind of anything. I'm just kind of going
Yeah,
along.
so just
She says, I got to get off this stuff.
stunts your energy.
Yeah,
like
I have to
turning
get
off
off
the
this. She
light
goes, I don't
switch.
know why. I said, well, it's cold. There's nothing there, nothing happening. So you're right. I mean, exactly right. This is what happens, right?
And we're working in people's energy fields
Yeah.
every day, whether you know it or not. It's there, and you're interchanging your energy with them. So
You
those
bring up
side
a really
effects are-
interesting point. If this is happening on the individual level,
right,
what's happening at the family level in terms of energy,
right,
or at the community level,
Right.
or at the national level, right? I mean, the energy of America is the energy of people who are walking around taking 10 prescriptions a year, compared to, say, the energy of, I don't know, Australia or somewhere else.
And the
And
funny
you could
thing-
argue that it's good or bad, but when you
Right.
look at where we are
how
and
it's
how
feeding
we're
into
seeing,
the universal energy. Yeah.
right, and how we're seen in the world,
Consciousness.
we have 6% of the world's population and we consume, 60% of its resources. We're seen as the world's bully in many
greenies.
people's eyes and so on. So we are who we are partly because of how we're being affected by the chemicals that we're putting in our body.
Exactly. There's something I really want to bring up on this show for people to understand. We talked very briefly about Munchausen, okay, and the fact that if mothers or parents want to take their children off drugs and put them on natural things. Now tell me what's it called? Munchausen what?
Well, there's a syndrome that's spoken of in medicine that's called Munchausen syndrome. It's
Right.
named for the doctor who first described it. It's considered a mental illness or a psychiatric diagnosis. And essentially what it amounts to, and it's a very, 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 very rare occurrence, is that a caregiver will actually be harming the person in their care, like an elderly parent or a child or someone who can't care for themselves. They're actually harming that person in a way, consciously or otherwise, in order to bring attention to themselves.
Yep. I learned this in psychiatry, psychology. Yep.
Okay. So, and classically, among the criteria by which you measure this or figure this out is that when the person being cared for is removed from that environment, they improve, right? This is now being used in some states. Connecticut is not one of them, but it is being used in some states against parents who, well, not necessarily parents, but persons who seek non-conventional care for a loved one. It could be a child or an elderly parent or someone in their care, because the authorities who, in my opinion, are enforcing the state-sponsored medicine, which is conventional medicine, right, are arguing that using non-conventional medicine is somehow harming that individual.
Wow.
And it's simply enough in some states to say that if you're not using conventional medicine, then you're bringing harm with no proof.
And they can take the child away from
They
you.
can take a child away for child abuse and whatever. Now, interestingly, from a legal, I want to say a legal discussion that I recently read on this, is that in some of those cases where children are being seen by medical doctors or others that are using non-conventional treatments, and they're taken away from the parents who are overseeing this, when that happens, the child worsens, right? Since this syndrome is defined in part by the child getting better under the normal conditions,
Yeah.
if the child is being harmed, you would expect them then to get better.
Exactly.
But the opposite is happening. They're seeing non-conventional practitioners and they're doing well, and then they're taken out of that environment and then they worsen again, right? Because that's happening, that criterion, according to this legal paper I was reading, that criterion is now being removed from the definition.
Wow.
So we don't have to look at that anymore.
Even though
so-
that was the official
It was part of the official definition.
definition of the
That's really going too far.
This has been going on in the United States for a long time, where
So they're
children are
changing
taken
the rules just so that they can actually prevent people from taking their children or themselves to.
There are a number of states where this has happened, where
Alternative.
children are taken from their parents because the parents are doing something other than what's been advised by conventional medicine, which puts conventional medicine and its practitioners in a pretty unique place.
Exactly.
Right?
Exactly.
When they're deciding what's happening to you, not you.
And how can they do that? How can they decide for you like that? That's so wrong. It is so wrong. I don't know. And now there's another thing too. For babies, I was reading they want to put
the gastro reflux.
Yeah, you know how we all burp up a little milk. Now they want to put them on acid reflux medicine.
The acid, yeah.
Babies, little
Yeah.
babies.
Yeah. You'd be surprised how many infants who spit up are put on the acid
That's
blockers.
crazy. That is such craziness.
Well, you know what? It seems like insanity
It is. It
on
does.
the part of the practitioners.
Yeah.
But how is the public falling for this? I mean, if you had a baby and your pediatrician wanted that baby to be on an acid blocker because they're spitting up after they're eating, why are people tolerating this?
I know.
Why don't they tell the pediatrician what they think? Why don't they get a new pediatrician? And why don't they just burp the baby?
Yeah.
Right?
It always happens. It does.
Right.
And
I honestly think it may be more chronic because of the formulas and the foods that even the breastfeeding mothers are eating foods that the babies can't tolerate. And so, okay, let's look at that first, Let's look at what the cause could be first.
If it's happening too much.
Right.
Yeah.
And I even know, because I've been through this before with chronic heartburn, and you take, antacids, and then it's like cyclic. It gets worse and worse because your body's supposed to be producing that acid to digest your food. So, like what was the cholesterol situation where your body produces more of it because there's something going in to shut it down, and then you have this cyclic effect that just keeps getting worse and worse and worse, and you have to take more and more and more, and yeah.
And there you are, back to the discussion at the top of the hour here, which is
when
you use the medication to stop a symptom, not to cure the problem. Then it produces a new problem, and then you have to have another medication for that.
I feel sorry
It's
for
like running around on a hamster wheel.
I feel so sorry for the babies that the parents believe that that's true, and they do that to them.
Now you see, why can't someone who understands what Traci just said have that child taken from its parents because the pediatrician recommended a medication to suppress the acid? The acid is there for a reason. Let's talk about, is that child abuse? When you thwart the natural process in the child's body? Or is that okay because conventional medicine says this is the standard of care today? That'll change in a few years because it always does.
Yeah.
Right.
And look at that Gardasil.
Oh my.
That went crazy with the commercials,
this is
constantly.
I read a whole article on
And then
this
I read and saw on the computer, on the little videos, this one girl who took it, and she's just, her whole body's changed, her whole chemistry's changed. She used to be vibrant and happy and alive and doing
chronically
now she's chronically fatigued. And then I read there was over 1,000 girls that died from this. I'm going, and then I didn't hear any more.
And who's responsible? Where's the liability in this case?
Exactly.
We want you to take here. You got public health officials and the conventional system saying you want to take this, you got to take it, you got to take it, and then you start to see the side effects where we've been talking about. You start to see the side effects. Who gets to live with the side effects? Who gets to pay for the side effects? It's always
like the vaccine, just covers like one strain of this particular virus that has like 50 strains. So, you could take the vaccine. It doesn't guard you against the other 49 strains of the disease anyway. So, really think about it.
It's crazy.
I think there's another thing that we ought to mention before we get to the end of the program, which is there are people watching who are thinking, and there are doctors watching who are thinking, look, I get my information from the medical journals. Right.
Yeah, I was just going to ask you about that.
I know.
And right.
I don't have any quotes because I'm bad at quoting. That's why we bring you on for statistics.
Go ahead.
Well, the idea that
where do they get their information?
Where I'm getting my information, I don't listen to the drug rep. I look at the journals. I don't have a lot of time to read the journals, but I look at the journals. I see what's there. I see what the standard of care is for my profession, and so on and so forth. Well, two things. First of all, as a naturopathic doctor, it's interesting to watch how the standard of care changes over time. Because what's in vogue, I'm using that word on purpose, now is not going to be in vogue in 10 years. Right. And if medicine were practiced based on specific principles of restoring balance in the system, we wouldn't be changing our mind all the time.
There would be some constant fallbacks, that, okay, well, you should take, this particular herb or something. There's something that through history we know has worked, not like what's the newest drug.
I agree.
Right.
And the other point is that, and I think most of your viewers who are doctors know this, is that the journals aren't what they used to be. A lot of the
Right.
research these days is funded by companies that have a particular agenda. I had heard at a lecture that I went to at a national meeting that the editor of The Lancet, which is probably at one point was the most widely respected medical journal in the world, that the editor of Lancet resigned a few years ago, saying this is nothing but paid advertising now.
Wow.
The journal itself. Now, I'm not making this up, and I'm not really qualified to talk about this in detail, but there are people who are, and there's a fellow up at Harvard by the name of John Abramson, medical doctor, researcher. I believe he's the head of the Department of Family Practice there, although I'm not entirely sure of his credentials. And he became aware of this issue in his own practice. He was looking at some journal articles, and he felt like, you know, the conclusion that's presented in the article is not supported by the information that's being described. And if it's true for this article, how many other articles is it true for? So he enlisted graduate students to do what you do in an academic setting. Let's just check this out, right? He was appalled at the sloppy science and the sloppy research that's now passing for medical research. And he's actually written several books about it. I'm sorry I have forgotten the name of his most recent book. But again, viewers, I'm sure they could find this information online or by calling Harvard University and tracking down John Abramson and looking at the work that he's done and documented about how poor this is. So my point is that the information on which the most judicious, thorough, altruistic, intelligent, well-meaning doctor is making his decisions.
And
we don't have to assign any kind of...
Everybody goes into the field, I believe, with the truest of intentions, wanting to help the patient. I don't think anybody goes into it saying, you know... But
if the information that you're given is biased, obviously you're going to have trouble making decisions that are responsible. I mean, ultimately, the physician's job and the oath that a physicians take is to protect the public health and to do no harm. And there's no excuse, in my opinion, for doing harm when you are, I mean, if you're given false information or knowingly biased information, where's the liability? You know, who's responsible for that? Is it the practitioner? Is it the national medical associations? Is it the journals themselves for not being more thorough and so on?
Is it the drug
companies? even when somebody's trying,
I had a friend who was a drug rep for a while, and she said it was the most. She said it did such damage to her psyche because for years she'd go out and she'd have to schmooze the doctors and drop off lunches and put all the little pads with the advertisements for the drug on it and the pens, so it's just in their face every day. I mean, it's the same kind of marketing we get, on the TV and in our magazines for the drugs, only tenfold. And
the New York Times did a series of articles. I think it was about this time last year, it might have been in the spring of this year, on exactly what you're saying, on drug reps and who they are and where they're recruited from.
It's a sleazy job.
And well, do you know the thing that was interesting is, do you know where the drug companies turn for, what group of people they go after to recruit for drug reps? Cheerleaders.
Yep. Yeah.
Really?
Actually, that kind of fits her profile. That's perfect. Yep.
Well, right. Now,
tell the people why. Yeah.
Well, the New York Times speculated about why would you hire cheerleaders to sell your drugs?
Oh yeah.
Not science majors, not the chem majors, not the biology majors, not medical students, cheerleaders, right? Of course, you know what the drug company, I don't know which company, nor do I remember if it was a spokesman for the American Pharmaceutical Association, but of course the industry side explained it away by saying, Well, these are exactly the kind of people you want to be salespeople. They have all those qualities of enthusiasm and follow-through and dedication and so on. But some of us think that the reason cheerleaders are chosen to sell medication has something to do with the fact that most doctors are men.
Yes, I would think so.
And most cheerleaders are women.
Women, and they're pretty attractive with great bodies, and hey, that's what makes the world go round, right?
But that's pure speculation, right?
Yeah,
we haven't done the research on that and
No.
published it in the journals yet.
That's right. That's pure speculation. I don't know what the drug companies have in mind. What's happened compared to 50, 60 years ago when they made some good drugs, they helped some good people, they did a few things, and it just got worse and worse and worse and worse and worse. And now it's
Well,
like,
isn't it obvious?
well, mad. It's mad. Greed. That's all I can think of. Greed. How much money do you need? How much money do the shareholders need? The stockholders need? It's crazy. It's absolute craziness.
Yeah.
Is that what you're going to
Right.
say?
Well, I think so. You know, when I look at it from my point of view, now this is, for the conventional minded, what I'm about to say is pure speculation. But as a naturopathic doctor who's been in practice for 30 years and watched a generation or two, the model that we use in naturopathic medicine and the way I've been taught to see the world suggests to me that what Traci was saying about the way people's energy and their biology is affected by these drugs, which are pollutants at the personal level, are not just polluting us, but they're suppressing or polluting generation after generation.
Right.
The kids in this country are probably sicker than any on the planet. And you look around, 1 out of 80 children, or some people say 1 out of 100, again, it depends on your statistics, but a very large number of children in this country are autistic.
Wow.
A very large number are hyperactive. A very large number have diabetes, arthritis,
There's a
and
problem.
so on and so
There's
forth, right?
definitely a problem.
And like you just said, 20, 30 years ago, these things were rare. What's changed? They're not genetic because you can't explain the explosion of
Gonna
these
have to-
numbers that way.
We're going to have to cut you off there because this could go on.
We have to have you back. I
know.
mean, it's just
It'll be my
so
pleasure to
much.
do that.
Would you come back again?
I will.
Okay, we just continue and go on.
We're gonna
I
give
want
your
to thank you
information.
so much.
My pleasure,
It was wonderful.
Traci. My pleasure.
It was wonderful. We're going to give your information now.
All right, and this is Dr. James Sensenig, naturopathic physician, and he is located at Natural Health Associates, that's in Hampton, Connecticut, and you can reach him at 203-230-2200 or visit his website at www.naturalhealthconnecticut.com. And to contact us, you can reach Rosemary at 203-627-7966 or myself, Traci, at 203-232-3405. Okay, or you can email us your questions if you have any questions regarding this particular show or any show that you see. Email us at healoutsidethebox@yahoo.com.
For show schedules, visit either www.rosemarylachance.com or www.entirebeing.com. And now I'm going to read the quote for tonight from our Book of Courage. The mask of your ignorance is the depth of your belief in injustice and tragedy. What a caterpillar calls the end of the world, the master calls a butterfly. That's from Richard Bach.
I want to thank you, and please join us
Thank
again.
you so much. Yes. Take care. Good night.
Good night.
As you look out through the window,